Okay, you went through clinic yesterday.
Yeah.
And your husband and
Gary?
yeah, you okay with that being in public and all this kind of business? Okay. All right.
It was very beneficial, I think.
Okay, it's okay to see the other patients and all the rest of that.
And I had 3 issues that I wanted to bring up today.
Huh?
The last couple times I went to give blood,
Yes.
I had low iron, so they refused me for giving blood. But it was, when I tested before for my packet, it was low normal.
Right.
And I know yesterday you said that the iron could drop.
Yeah,
So
should we talk a little bit about iron?
So I just want to, when should I start taking iron after the surgery?
Yeah, let's
to
talk.
replenish, that's what
Okay, iron and iron deficiency anemia is one of our biggest problems. In fact, in our female patients, not in our male patients, but female patients, almost 5% or 1 out of 20 people have low iron. It seems really high, but let me tell you that in women who don't have my surgery in the United States, the incidence of low iron is 3%. So it's a pretty common problem in the United States, especially in women, almost never in guys. So let's see if we can explain that. Once a month, women donate blood, right? They lose blood in their menstrual cycle. So the big issue for iron deficiency anemia is not so much the MGV, although it has an impact that we're going to talk about, but women in America, with or without the surgery, tend to get a high rate of iron deficiency. And iron deficiency anemia is really a very bad illness. It saps your energy. It causes skin and hair changes. It lowers your energy or intelligence. You know, you don't feel well with low iron. Iron delivers blood and oxygen, and you need it desperately to be a healthy person. And low iron is extremely common in American women, and our gastric bypass makes that risk worse. So you're right to ask about it. It's one of our number 1 fears. When we get people who come back with problems, the number 1 thing besides gastritis or an upset stomach or an ulcer is iron deficiency. And so we get phone calls like this. Hi, Dr. Rutledge. This is Ms. So-and-so. I am 3 years out. You're wonderful. I've done great. Everything is terrific. I do have a problem. Everybody says I'm pale as a ghost. This is a woman who worked at the IRS in Charlotte. And they say, and I am tired and I can barely walk. I mean, I look terrific, but I just feel terrible. And I said, well, have you been taking your vitamins? Hello? Hello? Well, no, I haven't been taking my vitamins. So one of the first things you can do, and kind of your question was when to start taking your vitamins. And a few days or a few weeks is not going to make a difference. The vitamins and the iron are part of a long-term therapy. Iron is very hard to get in because it has a little tiny way in. You might think about it as a reverse funnel. So it's hard to get the iron in. So you have to constantly give lots of iron, and not much of it's going to get in. Because iron is not soluble in water, so it's hard to digest it and absorb it. In fact, you have a very specialized area to digest and absorb iron, and it's in the upper gut that we bypass.
Is there such a thing as iodized iron?
Iron must be in a ionized form to be absorbed. Otherwise, it's called solid iron, and very little of that's absorbed. So if you grind up steel and eat it, not much is going to happen. And if you look later in the day or the next day, you'll see it come back out. So iron actually comes in a ferric or ferrous state, and that ionized iron, the ferrous sulfate or things like that, are what we eat as our pills, and little milligrams of that is all we can get. And when we realize it's very hard to get iron in, then it becomes real important to recognize that you don't want to lose any iron. So when our patients call and say they have low iron, the very first thing I do is refer them to a gynecologist. And the reason is we want to stop the losses because it's so hard to replace the iron. So for our women who are still having menstrual periods, we will have them see a gynecologist and work with them on methods of trying to cut back on the loss of iron by, say, taking a birth control pill There are some birth control pills you may have seen advertised that cause the menstrual cycle to decrease to once or twice a year, or 3 times a year, or 4 times a year. So the first thing we do to help you boost your iron is to stop losses through your menstrual cycle. So if you're still having that, that's step number 1. Step number 2 then, of course, is take oral iron, but very frequently oral iron is not enough. Yeah, very, very frequently you just can't get up. It's like trying to fill up a gasoline tank on a 18-wheeler with an eyedropper. It's just not going to work. Now there is a new solution that not every doctor knows about. You may know something about the New England Journal of Medicine. It's a very famous national journal of medicine. There was recently an editorial that said doctors don't understand and are not using enough of intravenous iron. There's a new formulation of intravenous iron that wasn't available 10 and 20 years ago when I was in medical school. And it's very useful, and it's used all the time in dialysis patients who are always losing iron because they go through dialysis. And so now we know, by using it in thousands and thousands of patients every day, that intravenous iron is a very good and very simple treatment. It's very powerful, it's very effective, but in this editorial in the New England Journal of Medicine, they felt that doctors weren't using it enough. And so intravenous iron is the solution for lots of patients in whom the oral iron doesn't boost your iron up right away. And what you'll find if you are like many of our patients and you get treated with intravenous iron is you will feel spectacularly better within a couple of days after your intravenous iron. So it's something you should know about, something that would be worth making a video on. Iron deficiency anemia is common in our female patients, not in the guys. So you can kind of drift off during this discussion. It's a very common problem. It's very difficult to fix with oral iron, but you should take oral iron. If you're having menstrual cycles and you have low iron, we want to stop or decrease the blood loss from that. And then if those things don't fix it, which they commonly do not, then your doctor needs to get intravenous iron for you. And you shouldn't be surprised if he's not familiar with that. And sometimes you have to go to a different specialist.
Okay.
Sometimes a hematologist or a nephrologist, because the nephrologist will be seeing dialysis patients and using it all the time. The old kind of iron, which was called iron dextran, had a high rate of allergies and allergic reactions and people having anaphylactic allergic reactions, which is the big time allergic reaction that can sometimes lead to actual death. And so intravenous and intramuscular old iron dextran is what a lot of us older doctors remember, and that's not the latest. It's one of those things, kind of like we think the mini-gastric bypass, new stuff has come along, and intravenous iron can turn you from a weak, tired, worn out, unhappy person into this very vigorous person because all of a sudden you got an infusion of blood, is exactly what happens. So beware of your iron stores, especially if you start off with a low iron, especially if you're a woman, especially if you're still having menstrual cycles. Those are the predictors for us. But if you get low iron, the thing to do, of course, is try the oral iron for a couple of weeks or a couple of months and see if it makes any difference. If it doesn't, there's a new, really remarkable treatment that's available, and that's intravenous iron. That might make it onto the internet.